Assalamu alaikum rahmatullahi ta'ala barakatuh, my fellow Gambians. This is going to be a very short update about COVID-19. Just one instruction to healthcare workers or people in small groups or light groups. The time you need the mask most is when you are talking. Yes, you can have a mask on and you can talk. And also the clothes masks I'm seeing in the Gambia, yes, they work. This is a disposable one. Where I am now, I shouldn't be wearing. I don't have to wear it because I'm not close to anybody. But I am wearing right now just to demonstrate something. You need the mask most when you are talking, because this is where you spread liquid from your mouth, the saliva from your mouth or your nose, whatever. So that's the time you need it most. But the most effective key or prevention measure for COVID-19 is physical distancing. So my fellow Gambians, we are in a situation where only Allah can save ourselves. And yes, let us continue to hold our government to account. They disappoint. They've been too corrupt. They've been too slow. They are ill prepared. Let's continue to hold them to account. But let us take responsibility ourselves for whole health and safety. These people might be the least to be infected with these things because they don't go to Serekunda market. They don't go to the mosque we visited. They are still away from reality. So it is us, the common man, who are at the verge of who are more likely to catch these infections. So we have to take responsibility of our actions. Always, as usual, that is still valid. Wash your hand with plenty of soap for at least 40 seconds all the time. Like if you come from outside, you go into your house, before you touch your kids, before you speak to anybody, go right into the washroom and wash your hand thoroughly. If you don't have a soap, use alcohol hand-based soap. This is very effective as well, even though the soap is more effective. And if you don't have to go out, please don't go out. Stay at home. But if you have to go out, please put on the face mask. And when you are talking, you pull the face mask down, you are putting everybody at risk. That is when you actually need the face mask, not when you are not talking. So I've seen it in TV and everywhere. When people are talking, they will pull down their face mask. That is not the time to pull it down. Gambia is at a situation, our healthcare system, let me tell you, is at the verge of complete collapse. It was collapsed anyway before even COVID-19. Gambia healthcare system is one of the worst in the world. Let me tell you that. Before COVID, every day I speak to senior government officials. I know the challenges they are facing. For example, right now, RVTH, they don't even have a regular running water all the time. They will have water for some time, and when the now it's gone, it will go. And I managed to contact senior official from Nawek. How is that possible? They told me they did their best, and they put a proposal for RVTH what they can do for a bag of water, so that when the Nawek generators are not working, where they can get the water. But the RVTH operation team, they don't do anything about that. When we managed to contact the operation manager, one Mr. Mbaye, he refused to respond. In typical Gambian fashion, he refused to respond to our calls. So this is the situation. We have one major referral hospital. Right now, they cannot even provide regular running water. Just think about that, regular running water. We are in the middle of pandemic, which need water at all time for the patient, for the staffs to wash their hands regularly, and also for the visitors. So you can see the challenges we are facing. So that's one thing. That's why I'm talking to the general public. It is us. Let us take responsibility of our action. You don't have to visit the mosque right now. This is very clear. There are a lot of Islamic injunctions. It may rain. When it is raining, we can forgo our public prayers. When it is very, very cold, we can forgo our public prayers. So, but this is a matter of life and death. COVID is serious and it's very, very contagious. is very, very infectious, one of the most infectious virus we've seen in modern time. So that's why we have to take responsibility of our actions. If you don't have to go out, please stay at home. That's my advice. Because if you go out, you don't know who you meet. Right now, 6 persons are at large. 2 of them, they believe, are still in the country. They believe 4 of them leave the country, which I cannot ascertain. But what I'm telling you, our healthcare facility is almost non-existent now. Gambia population ratio to doctor is 10,000 citizens to 0.1 doctor. But we cannot have 0.1 doctor. So if you multiply everything by 10, every 100,000 Gambian to 1 doctor. That's the ratio. And already we have 10 doctors infected already, 12 nurses infected, and 16 support staff. By that support staff, I mean the orderlies, the lab staffs, and others who work in the hospital. So all these people have contact with their colleagues, and all those colleagues, they work closely together, are all under quarantine now. So I don't know the actual number of patients on the. I don't know. Oh, sorry, somebody just called my mobile. I don't know the number of patients on the current number of staff on the quarantine, but it's a significant amount. Already, 65 in total. 65 are on the quarantine from a healthcare facility. So if you have 100,000 Gambian to 1 doctor, and 65 is out of that, that is a significant number. That is a significant number. So what we can do now is to protect ourselves and stop public gatherings. Let us stop our christening ceremonies, our marriage ceremonies, whether it's state of emergency or not. Let us just try to protect ourselves. We've seen how the president abused, how the president abused the state of emergency, and now it is the time we need the state of emergency most. But he cannot. He don't want to upset the Muslim community, because the uproar it will generate. He's been politicking. Now we need this state of emergency. If he declare one, the anger of Muslim community, how they're going to react politically, that's not good for him. So we have seen how our politicians are putting our lives on risk, on the line, just for their personal interest. That's why I'm appealing to Gambians to take responsibility and look after ourselves, because the government who we are sustaining are not looking after our interests. They're only looking after ourselves. If not, you can say Almighty Allah give Gambia all the opportunity in the world to put things right. We've seen the numbers have been increasing on daily basis in Senegal and other neighboring other neighboring countries for 3 months, while our numbers are stabilized. But what have they done? What have they done to build that healthcare facility, to make sure that they have personal protective equipment in stock, so that our healthcare personnel or frontline workers are protected? They don't. Look at the money they spend during that time when you don't even have the numbers. And now they need the money when we don't have it and when we have the true infections. So this is the situation. It's going to be a quick video just to appeal to Gambians to take responsibility of our own health and continue to hold this government to account. But right now, things are not looking good. Our healthcare facility is at the verge of collapse. It's collapsed already, I can tell you, because it's not there anyway, even before COVID-19. But with all these medical staffs infected, very, very soon. And we have other illnesses as well in the Gambia. We are right in the malaria season. We have people with debilitating chronic medical conditions. So what is going to happen? All the attention is going to go to COVID, while we have other illnesses. They're going to be neglected because we don't have the capacity. So that's why the healthy one, we have to protect the other chronically ill population of our country. Everybody have to take responsibility. If you are watching this video, I want you to call 5 people in the Gambia and tell them about the information you hear here. Let us think it is not COVID-19. COVID-19 doesn't mean other illnesses are going to stop. They're not. They are there and they are going to increase. We are in the rainy season. And also this is the hungry season for the Gambia. Most of people are struggling to put regular food on the table. And malnutrition and lack of proper diet also is a co-founding factor. It can make any kind of illness worse. That's why we have all these infectious diseases in Africa, because people are not properly fed. So that's another problem we have right now. Not only medical, but COVID doesn't stop other illnesses. And malaria is going to is also going to increase. In fact, this was specifically mentioned last week by WHO. They fear that in Africa, COVID is going to increase the number of mortalities as a result of malaria infection and other endemic diseases that are endemic in Africa. Thank you very much for watching, and please share the video so you can get to as many people as possible. Thank you all.